I'm Dr. Manu Gujrati, Medical Director of Parsa Mohebi Hair Restoration in San Francisco. Today we're going to be talking about male to female transgender FUE hair transplant surgery. So stay tuned to get all your questions answered. What is transgender male to female hair transplant? Well, the point of a procedure such as this is to allow, in the gender reassignment process, to give that full final look of a female hairline, a feminine, soft hairline, to finish the framing of the face. And that involves usually lowering the hairline, bringing in the sides to give the right characteristics to the face and the hairline. How do you decide what type of hairline design for a transgender patient who's transitioning? When it comes to designing a hairline for a transgender patient, many of the same aspects that we consider in any patient would be considered as well. It all depends on the facial structure of the patient to begin with. The length of the face, the different characteristics. So we do certain measurements to figure out where the ideal hairline should be to balance with the other features of the face. And that involves the height of the hairline, meaning how far from the eyebrows up the hairline should be. But more importantly, in especially male to female surgery, is the corners. Instead of having a very sharp look, which is a more masculine look, a female look tends to have much more of an arched, really nice, gentle border. As well as certain elements, which is kind of like the natural sort of hump that the hairline has on the side, as opposed to the much more straight hairline and borders that a masculine hairline would have. So all these things have to be brought into the picture in the design and planning to make sure you get the best result for male to female transgender FUE hair transplant surgery. So the question is, what information would I share with a patient, any patient coming in talking about transgender hair surgery, and what is the recovery process like? It's an important question for any patient to understand what recovery after a hair transplant procedure would be like. In the transgender hair transplant procedure, some of the similar things have to be kept in mind, which everybody's going to want to know about pain and healing and things like that. So the great thing is with follicular unit extraction or FUE surgery that we perform at Parsa Mohebi Hair Restoration, pain is minimal and recovery is very quick. Your skin will recover very quickly. So from a general person's view, very quickly, within less than a week, it doesn't look like anything's been done. However, the most important thing when going through the male to female hair transplant process is waiting for length. Most of our female patients are going to want to have longer hair. What happens, however, in the hair transplant process is that initially you'll have short hairs that will be placed into the new sites where they're going to be wanting to grow, and they'll be there for a few weeks, but they're going to shed. And it's not till several months later, usually 3 to 4 months after the procedure, that they start growing again. That's the normal process of recovery for hair transplant. So that means they're growing from nothing, and it takes a long time to get to the length that some of our male to female transgender patients would like to wear their hair. That's kind of the hardest part, but there's nothing we can really do to make that happen faster. So we do have to be patient. Sometimes patients will transition their hairstyles accordingly, wearing a shorter kind of bob cut first, and then slowly letting it grow in and working with their hairstylists on that. Some of our patients will come in with their other native hair very long and want their transplant to catch up to that. And that can be a bit of a tough period, as the short transplant hair is still very, very far away from the length of the long hair. But in time, it does get long enough, and oftentimes, as for planting, especially in the front, once the hair is a few inches long, you can wear it back with a hairband or different hairpins, and it'll look like it's flowing into your longer hair. But oftentimes it takes over a year to get to the length that somebody really wants their hair at, sometimes even longer depending on how far down the sides or back you like to wear your hair. So does it take typically more than one procedure to get a patient to their desired result? This all depends on where a patient is starting from. the larger or more significant degree of hair loss there already is prior to the first procedure, the more steps it might take to get to the final desired result. If somebody's starting from a masculine hairline that has not had hair loss, it's less area to cover and change to get to a feminized, softer hairline. However, if the hairline has receded from the original masculine look further back into the temples, the top, or even the crown, those are larger areas that require hair to be placed in order to finally get coverage there and then also design the female hairline. So those can take several, up to 2, 3, sometimes even 4 surgeries.